The Innovation of the Catheter by me, Christian Landeros.
And me, Anthony Gerges. The use of the catheter. Catheters are medical devices that are inserted into the body to deliver medication, fluids, or gases to various organs or systems. Catheters can also be used to remove unwanted fluids or gases from the body. This here is a picture of a catheter being inserted into a human body. Catheter innovation. Medical technology continues to advance. This includes catheters. The longer a catheter is inserted and being used, the higher the risk of infection and other complications occur. Typically, catheters are left in place for 2 to 12 weeks, depending on the medical situation. However, many catheters are changed more frequently because of blockages and infections. Catheters are also uncomfortable to many people and can cause distress. So Christian and I, decided to use thermoplastic elastomers to make up our catheter because of their flexibility and durability, as well as a curved tip and antibacterial gel coating. These improvements will enhance patient safety and comfort. Prior art. So our predicate device is titled as biocompatible catheter with the US patent number right here, 20150133846A1. It focuses on a new type of catheter designed to be incredibly biocompatible and more comfortable for patients. This type of catheter helps improve the quality of life for humans, but as well for the earth by using these biocompatible materials. So this catheter incorporates titanium surfaces into the catheter structure, and this innovation provides better lubrication during insertion and reduces the risk of infection as well. Is our catheter a medical device? Yes, it is a medical device. By definition, a medical device is any instrument, apparatus, machine, implant, or other similar article that is used for medical purposes. Our catheter would be used to allow urine to drain if a patient has an obstruction in the tube that carries urine out of that patient's bladder. So, yes, our device will be used for medical purposes, and thus it is a medical device. Our device's classification. Our device will most likely be a class 2 device due to the possibility of infection, bleeding, and tissue injury. Catheters are categorized as class 2 devices. Um, the inclusion of gel coating for bacterial reduction and the introduction of novel materials such as thermoplastic elastomers may further boost regulatory bodies' attention. And the CFR that we found for the device was 21, like the 21 CFR was 21 CFR 876. Uh, and it was about like urological catheters and accessories.
Okay, so now I will be talking about the regulatory pathway of the catheter. So this device would require a 5110K submission as is to device and isn't exempt. So the catheter will have a lengthy process due to it being a class 2 device. Catheters are widely used in the medical field and they come in different shapes and sizes depending on the intended use for them. And the process requirement for the catheters are crucial to ensure that they are safe and effective for use on patients as they are being inserted into them for either short or long periods of time. So next I will be discussing the process requirements for the catheters. So since catheters are class 2 devices, they require lengthy processes to ensure their safety and effectiveness. Then also the sterilization process is crucial to prevent infections and should be validated to kill all microorganisms. Then catheters should also have an antibacterial coat to prevent infections and help with patient safety. Then also the selection of biomaterials is important to prevent adverse reactions or toxicities. And since we chose the thermoplastic monomer, it will be a better material for the catheter. Then the design and manufacturing process should consider the intended use, humble location and patient comfort, and should be validated to ensure consistent production meeting required specifications. Okay, so next I will be discussing the 5110K summary. When a 5110K submission is needed, as this device is moderate to low risk, being class 2, must be submitted to the FDA to show that the catheter is substantially equivalent to another device that is already in the market or that has been exempt from the pre-market notification. Then the 5110K submission helps ensure that the catheter is safe and effective for its intended use on patients. Then the 5110K also is needed to obtain clearance to be legally used in the medical field. Okay, so next I will be discussing the quality control for this device. So one component of it would be the inspection and testing. So this would be important because it helps ensure that the catheter meets the necessary standards of quality and meets up to its standards. Then some examples of testing would be mechanical testing on machines, biocompatibility testing on how the host reacts to the catheter, and microbiological testing to see if any microorganisms do pick up on the device. The second would be documentation. So after you do the testing, this would involve keeping accurate records and data, the production process and the testing to see all your different results and compare them. Then lastly would be the monitoring and follow-up. Then this helps ensure the safety and make sure the device follows its intended use and seeing how the patients are reacting with the catheter. Then lastly would be the risk management for this catheter. So the one risk management would be adequate training. So with having adequate training, this helps ensure that the medical professional knows how to properly insert the catheter into the patient and no damage is done. Secondly, would be carefully monitoring the patient. So this helps ensure nothing goes wrong while the catheter is already inserted into the patient and seeing if their vitals or anything wrong is happening with them. Then lastly would be safe and appropriate techniques. So with practicing these techniques, this will ensure a sterile and safe environment for the insertion of the catheter, making sure nothing goes wrong with it. Then lastly, these are our references. Thank you for watching our presentation on the catheter. In summary, this device will require a 5110K submission and very thorough risk management and quality control to make sure no recall happens on this device. And we will be innovating the catheter by using thermoplastic elastomers to make it more flexible and durable, and also an antibacterial gel coating around it to make sure less infections happen.
Thank you and have a nice Thursday.